Hi, everyone. I'm Allie Morrison, and I want to show you a couple of tips you can do for upper back pain and stiffness. And you're going to need a foam roller and a comfortable place to lay down. So let's get started. One of the first things you're going to want to know about your middle to upper spine is where your ribs are and then where your scapula or your shoulder blade bones are in relation to it. So if you were to try to reach back and with my thumb, I'm just gently touching the very bottom of my scapula. So this little point, and you have them on both sides here. You can see mine wing out pretty good. But if you were to draw a line between these 2 points, you're going to connect with what is probably the tightest, stiffest part of your middle back. And then from there, upwards towards the neck, we tend to get more and more stiff. So I'm going to show you a good way to open it up. And if you have a foam roller, this works great. If you have a blanket or a towel, you can also take a blanket or a towel, roll it up, and it will work pretty much the same way. So now we know where the bottom tip of your scapula is. You're going to put that on the center of your roll. So I'm going to come down, move my elbows to in front, and see if I can feel this bottom part of the scapula touching my foam roller. Okay, that's my first point. Then I'm going to lift up, lace my fingers together, place them behind my head. At this point, you want to relax the weight of your head back into your hands. So as you gently move backward, this takes you into spinal extension. This is a fancy word for saying back bending in the upper back, which we also call chest opening or shoulder opening. So move slowly here. Let the weight of your head drop back. Allow your elbows to move wide. Let your chin drop in towards your throat just a little bit and press the upper palate of your mouth back into your hands. That gives you some orientation. So if you can take your tongue to the roof of your mouth, that takes you into the upper palate. Okay, now slowly lift up to a neutral position so you're looking forward. Now we're going to move into that spinal extension again, not quite as far. And you're going to do some side to side movements. So if I was sitting up, it's going to wind up looking something like this. You'll have your hands behind your head and you're going to slowly drop one elbow down and then the other elbow down. So be moving in this side to side plane. Go back to your position again. Put your shoulder blade tips on the roll. Hold the back of your head. Widen your elbows. Now drop your head back not quite as far. And now very slowly, you're going to bring one elbow in the direction of your waistline. Come back to center. And then slowly bring the other elbow in the direction of your waistline. And come back to center. So this is called mobilizing. And these particular vertebrae of your upper back are really not accustomed to what we call lateral flexion, which is a fancy way of saying moving side to side. So our hips are accustomed to a little bit of lateral flexion. Your rib cage is accustomed to a little bit of lateral flexion. But this upper part of your spine, not so much. So you're going to move side to side. And as this gets better, you may find you can drop your head back a little bit further. Let's start that movement again. Elbow towards your waistline. Elbow towards your waistline. And again, you can be doing this on a foam roller. I'm on a really soft foam roller. It's pretty squishy. You could just as easily do this on a blanket, beach towel, especially if the blanket is a very firm weave, like a dense blanket. Okay, come back to center. Now drop your head back. See if you can go a little further back into this back bending shape. To come out of it, you can lift your elbows if it helps, and then use that to help your head as you lift up. Now, once we get to here, you're going to do a little walk. So we're going to walk our shoulder blades down the foam roller just a little bit. Just moving very slowly. And now try for your spinal extension again. Okay, now we're getting that middle to upper part of your thoracic spine. Once again, kind of lift halfway up out of it. And take elbow to waistline, elbow to waistline. Slowly mobilizing. Every vertebra is connected to the one above and the one below via ligaments. And then within the musculature and connective tissue, these vertebrae are connected to vertebrae that are 2 and 3 above it and 2 and 3 below it. Now, anywhere the vertebrae are located next to so many other vertebrae and simultaneously to these rib joints, they're called facets, and they're moving out to the side. You're talking about this one of the strongest parts of the spine, which then translates into one of the stiffer parts of the spine. So now drop the head back. Maybe go a little bit further. And again, slowly elbow towards the waistline, elbow towards the waistline. I think it's helpful to keep the head perhaps kind of looking up at the ceiling. You do want a side to side motion. It's almost like you're bringing your ear towards your shoulder. Come back to center. See if you can drop back a tiny bit further. Lift your elbows to help you lift your head and slowly come up. Okay, that's a quick and easy one, but that one is really fantastic for helping you open up the chest, for helping you get more mobility in your shoulder girdle, and helping you to move your spine, particularly your upper spine, in a way that your normal activities are not going to ask you to do. So, well, what does that do? Okay, so you loosen up the upper part of your thoracic spine, and then perhaps next thing you know, the neck is just feeling looser as a result. The foundation is feeling better, has more circulation, and has opened up some of those stuck areas. Okay, thanks everyone. Namaste.